Let's talk about ketamine and going down the K-hole. Ketamine was derived from PCP in 1962 while looking for the optimal battlefield anesthetic. They didn't think they had found it, and so they began using it in veterinary medicine as an anesthetic. It wasn't until 1970 that it was approved for human use, and even then, it didn't get its first human clinical trial until 1995. Even then, it didn't begin gaining large, routine human use until the early 2000s. Let's look at how ketamine is used and abused. Ketamine is used for many purposes. It's used for sedation, analgesia, migraines, depression, PTSD, and anxiety. However, it does have a moderate potential for abuse, and it's listed as a DEA Class 3 controlled substance. It has moderate abuse potential with accepted medical uses and may lead to moderate or low physical dependence or high psychological dependence. So how does it work? It works for sedation by rapidly inducing a state of dissociative anesthesia with superficial sleep. It works by non-competitive inhibition of the NMDA receptors in the brain. By blocking these receptors, it reduces excitatory activity in the brain, leading to sedation. By blocking NMDA receptors, it reduces the intensity of pain signals sent to the brain, which alters the perception of pain. So let's look at side effects. Hypertension, tachycardia, and it can cause very vivid hallucinations, which are sometimes terrifying. Let's look at contraindications. Acute cardiovascular disease, large amount of secretions, especially during RSI, which we'll talk about a little more. Glaucoma, less than 3 months of age, and active pulmonary infection or disease. And once again, that ties back to the large amount of secretions and complications with RSI. So let's look at our protocols. Our protocols dealing with ketamine are pain management, procedural sedation, chemical restraint, and RSI. For pain management in adults, for greater than 100 kilograms, it's 300 milligrams IV drip in 100 milliliters. For less than 100 kilograms, it's 150 milligrams IV drip in 100 milliliters. For procedural sedation, it's 1.5 to 2 milligrams per kilogram IV or 4.5 milligrams per kilogram IM with a repeat dose of 0.5 to 1 milligram per kilogram IV or 2 to 4 milligram per kilogram IM. For chemical restraint, it's 1 to 2 milligram per kilogram IV or 2 milligram per kilogram IM. And for RSI, it's 1.5 to 2 milligram per kilogram IV. Our contraindications are listed over here. If you have any questions, as always, please come see me.